Hello, I am Ashley Young, and I'm going to be giving a brief presentation on the Italian healthcare system. I'm going to begin with an overview of the Italian population and their healthcare structure. Italy has a population about 1/5 the size of the US. Their GNP is only about 1/10 of America's. But their average life expectancy is about 82, but the US life expectancy is only around 78. They also have very similar causes of death to the US, with cardiovascular disease being the leading cause. This is pretty common in the Western world. However, a large population of Italy smokes, which leads to lung disease and cancer, which has a very high mortality rate and can be extremely expensive to treat. So Italy spends about $2,700 per person on healthcare each year. Compared to the US, where we spend almost $11,000 per person each year, this is some significant savings. Their healthcare system is run by the Servizio Sanitario Nazionale, which is associated with the national government. The SSN, for short, is responsible for imposing regulations on healthcare coverage to each regional healthcare system. This system allows patients to choose one primary care doctor and one hospital to receive care from and ensures basic services are provided to all citizens with little to no cost. These basic services are referred to as the LEA. In addition to this public coverage, citizens can get access to private insurance. This insurance is similar to supplemental Medicare insurance in the US and allows patients access to additional services not covered by the public insurance. It can also allow patients to choose upgrades to their healthcare, such as private hospitals or rooms, and priority access when visiting physicians or the emergency room. I'm now going to review the infrastructure of the healthcare system, including regulations, training, and financing. Public insurance provided by the SSN is covered by taxes from the national government. The corporate tax and national value tax are the two main ones mentioned. This money is divided amongst the regional healthcare programs, with special accommodations made for regions with large low-income populations. Regional systems are also permitted to create additional taxes to cover services not required by the federal government. Unfortunately, these taxes are not optional, and all citizens, including permanent residents, are required to pay for all services, regardless of if they need them. Voluntary healthcare or private healthcare is offered through a few different services. Employers can choose to provide this coverage to their employees, similar to how it is done in the US. Or people can choose to purchase this on their own through third-party insurers, which can be nonprofit organizations or private businesses. This insurance gives patients access to more providers, an option to choose their own hospital, and additional services, including cosmetic surgery or non-essential medications. They also may have coverage for dental and eye exams, which are currently not covered by the public insurance. In Italy, physicians do not have to obtain a bachelor's degree before entering medical school. Instead, they start a 6-year program where they receive a degree specifically designed for physicians that's nationally accredited. They must also take national licensing exams and receive specialized training before practicing independently, similar to how it is done in the US. Most nurses choose to go through a standard 3-year training program, but they can choose other options such as a master's degree or doctorate in nursing at a cost to them. Unlike in the US, physician and nursing training is mostly covered by the government, and trainees only have to pay for examinations, which average about €100 per exam. This graph highlights discrepancies in doctor to nurse ratios in EU countries. Italy currently has a nursing shortage, which they are trying to overcome by creating programs for foreigners to train in Italy and work as nurses. While there is some immigration of doctors, it is not nearly as significant as the nursing shortage they are currently suffering from. Currently, a trend in Italy is for foreign nurses to come into the country and take in-home or private nursing jobs. These jobs pay significantly more and make it difficult for in-country nurses to pursue more lucrative positions. Physicians are also limited to about 1,800 patients to prevent physician overload. This is supposed to help prevent burnout and help physicians provide better patient care. This is one of the reasons why physicians are choosing to stay in country instead of leaving like many nurses end up doing. Regulations on the Italian healthcare system are similar to those in the US. The SSN and regional healthcare regulators are allowed to impose rules on hospitals or physicians practicing within the region. A unique regulation of the Italian healthcare system is the requirement for primary complex care units. These units are similar to patient-centered medical homes in the US and are designed to provide better continuity of care for their patients. Additionally, the government is allowed to regulate approved medications and physician training. Unlike the US, every citizen is required to use the government-provided medical care and be established with a primary care physician in their region, which they must contact for any healthcare needs. Pharmaceutical regulation is also similar to the US. Drugs must be approved by a licensing agency before being sold within the country. The major difference in Italy's regulation is the price negotiations that occur before the licensing is given out to drug companies. The SSN has a department dedicated to negotiating a price it will pay for the given drug with the creator. If this price cannot be agreed on, the drug will be sold as a Class C drug, which is not covered by insurance. These negotiations have led to significantly lower drug prices for patients. While these costs are ultimately covered by their high tax rates required to support their insurance, the out-of-pocket cost is only about 5% of what some drugs cost in the US, like these comparisons of diabetes costs in the graph on the right. Unlike the US, a drug that is not covered by insurance will be full price to patients. There are no discounts for those with insurance like there can be with US drugs. Now I'm going to do a comparison of the different types of healthcare coverage in Italy. As we have discussed before, the public insurance coverage is decided at a national and regional level. Positive services are services required by the national government that all regional services must provide. The funding provided by the SSN is intended to cover only these services. Negative services are not required by the SSN, and regional governments can choose to cover or not cover them on their own. Prescriptions are also divided into categories based on what must be covered by public insurance, either for use at home or in a hospital setting. Additional healthcare services such as dental insurance are not required to be covered for adult patients under the SSN. Coverage of these services in patients 18 and older are at the discretion of regional administrators. As I've already said, private insurance is not required in Italy. It is meant to be a luxury service that provides a premium hospital experience to its clients, including private hospital rooms and access to premium hospitals. They can also access larger provider networks and see specialists more quickly than those on just public insurance. They also may experience coverage of additional drugs not currently covered under public insurance or additional services such as non-medically necessary surgeries or dental and eye exams. Overall, Italy has positive and negatives to its healthcare system like any other country. They report significantly lower obesity, mortality, and excessive drinking rates than any other country, but they continue to have a large population that struggles with smoking. They also struggle with many of the same challenges we do in the US with respect to providing equal care to those in disenfranchised populations and those within rural areas. There is also a large percentage of unmet needs identified by the government, and while public insurance should keep out-of-pocket costs low, this is becoming a challenge as private insurance continues to drive up rates, as you can see in the graph on the right. Finally, I am going to look at opportunities for the US to use Italian healthcare strategies in our own system and policies from Italy we are already using. As I have said before, the US regulates the healthcare system very similarly, especially with respect to public insurance. The US federal government is responsible for providing guidelines for prescription medications and general hospital and medical facility operations, but the states are allowed to impose additional regulations on these organizations. We also have extensive medical training required for physicians and other medical staff. There are some positives to the Italian system that the US has yet to implement. Primary care has become a major focus of the future of healthcare in our country, but Italy has taken this one step further by requiring all citizens to have established care with a primary care physician. This really encourages preventative care and has been shown to increase patient adherence to their physician's treatment because of an established relationship. In the US, states are free to create additional regulations on the healthcare industry. However, there is not many incentives for creating public healthcare programs specific to people from a state or region. This is a great way of addressing regional healthcare discrepancies and could be successful given the large and diverse population in the U.S. Additionally, before PPOs became a popular insurance plan here, primary care providers were viewed as gatekeepers to specialists. This helped prevent excessive use of specialist services for uncomplicated chronic illnesses. This is still present in Italy and prevents a lot of unnecessary use, so people with complex diseases who require their care to be provided by a specialist have easier access to it with lower wait times. Another positive of the Italian healthcare system is the way physician job availability is regulated. Currently, the Italian government ensures graduating physicians are able to find opportunities for work. This is not in the case in the US, where some graduating physicians are unable to find a residency placement after finishing their training. If the number of residency spots were adjusted to ensure all graduating US physicians were provided residencies, physician shortage problems could be solved. Overall, the Italian healthcare system is not perfect. It has many problems that will need to be addressed in the coming years, similar to almost every other country. However, they are actively working to develop a more effective system, and I believe the US should learn from many of their programs they are currently using as a framework for any changes we implement within the next few years. Thank you for listening to my presentation.